my name's Jeanette. I'm going to be your student nurse today. Can you go ahead and verify your name and date of birth, please? Okay, that matches up with her wristband. The doctor has ordered for me to put in an indwelling catheter. Does that sound correct? She says it does. Okay, I'm going to go ahead and raise the bed here to a working height. And while I do that, I would just explain the procedure to her. Okay, I'm going to go ahead and move the blanket back here. Okay, Mrs. Smith, I'm going to expose only the area that needs to be exposed here. I'm going to position her feet would be flat on the bed, her knees bent, and her thighs pointed outwards. Okay, and this is the point where I would perform hand hygiene, put on clean gloves, do peri-care, and then remove those gloves and perform hand hygiene again. So we're going to say I did all of that. I'm going to come over here. I deep cleaned this surface before, so it's okay to put this tape on here for later.
I'm going to perform hand hygiene and then put on gloves and do peri-care.
And I also have my red biohazard bag over here beside the bedside.
My gloves.
Okay, I have my catheter kit here. I'm inspecting it, making sure there's no rips or anything, and making sure it's not outdated. And this one's all good, so I'm going to go ahead and open it.
I'm going to grab my bag, make sure it's not expired and there's no tears or holes in it. I'll grab my package. When we touch my package, just put it on the sterile.
Position this here. Making sure to stay in that 1-inch border.
That's that ready. I'm going to open up my package, starting away from me, so I don't have to cross over the sterile field. And be touching the 1-inch border. And I'll grab my sterile gloves.
I'm going to get my sterile gloves out of here. Making sure to stay in that 1-inch border after I have them open. Okay, I have my sterile gloves on. Go ahead and get this out. I'm gonna go ahead and just set that down right there. Making sure not to touch the legs or anything. This has already been used, but we're going to pretend like it hasn't been.
Now I'm going to get my sterile field ready. This should be
Okay.
bottom of the field.
I'm going to go ahead and move
Turn this side down.
this here. There. I'll go ahead, pick up my alcohol swabs. I would take
I'll grab
that off with the sticks facing up. my lubricating jelly in it.
Organize this. Open high swab sticks. Stick side.
Okay.
Place those in pantry. And I will open up my lubricant
I'm gonna go ahead,
and put it in pantry.
attach this on
Next, I will
here.
grab my saline tube. This is for later.
Okay.
Open this up and connect it to the catheter.
Go ahead and be gentle when taking this out of the packaging to make sure that it only touches my
Doesn't go anywhere.
sterile gloves.
Sterility.
Okay. I'll bring this over here and put it in our
I will put this in the
lubricating jelly.
and I'll hope it's
I'd make
stable.
sure to get at least 2 to 3 inches, so then it's more comfortable for our patient. Okay.
Get that covered up so it
I'm gonna let
goes
that
in easier for the patient.
set there. Now I'm gonna commit my non-dominant hand to being unsterile.
This one's sterile.
Go ahead and separate
And this
this.
one, get 90 degrees. We're going back and forth to make it
Get this cotton pad.
happen. And I would take
Go furthest from me,
applicator,
front to back,
inner
discard,
starting on the front,
closest to me,
one pass,
front to back,
throwing away,
discard,
grabbing another one,
and then straight down the middle,
throwing away,
discard.
grabbing the third one.
Okay, Mrs. Smith, I'm about to insert your indwelling catheter now. You shouldn't feel any pain, but it might be a little uncomfortable for you. You might feel a little pressure. So I'm just gonna have you bear down as if you're trying to void, and take some deep breaths for me.
And to bear down, so it's trying to hold. And I'll count down from 3. 3, 2, 1.
Okay, I'm gonna insert this about 2 to 3 inches.
7 inches.
Or until you, that's usually when urine return happens, and an additional 1 to 2. So that's good there. I'm gonna stabilize it with my non-dominant hand. Come over here and insert 10 milliliters
Stabilize it with this hand.
of sterile water into the balloon.
I'll grab the saline tube.
And I'll make sure and document that. Take that off. I would usually throw this in my biohazard bag. I'm gonna set it right there for later.
Pull it slightly and make sure there's resistance from the balloon.
I'll pull and I feel resistance, so I'm gonna stop.
And
Go
so
ahead and put this down.
next, I will take off
I'll
the
get my
gloves.
tape over here, and I'm gonna tape it to the inside the thigh, making sure to allow enough room that if when she moves her leg around that she doesn't have any
And I'll need gloves.
doesn't tug on that catheter.
Take down the catheter,
So I'm gonna go ahead, I'm gonna move
making sure
the catheter bag
there's room so that the patient
below bladder level to an immovable part of the bed. Did that. I'm gonna go ahead and discard all of this. Can
Next, I will take the catheter down.
discard my
Hook it to a non-movable part
gloves.
below the patient.
I would perform hand hygiene, put on clean gloves. I could do pericare as needed again,
Next,
and I would remove those gloves and do hand
perform
hygiene.
hand hygiene again. And I will
I'll go ahead and cover Mrs. Smith back up. I'm gonna lower the bed back down to lowest position, and I would make sure her call light is in reach, and I would position her bedside table beside her with everything she needed. Is there anything I can do for you right now, Mrs. Smith?
put on, take off
She
your
said
gloves,
no.
put on your gloves,
So I'm gonna go out and I'm gonna chart
perform hand hygiene.
the characteristics of the urine, so color, amount, clarity, if there's any odor, and I'm going to document how much of the sterile solution I inflated into the balloon. I'm going to document the date and time that I did so, and so then they know that the procedure was done. and I'm gonna note how the patient tolerated it. So now that all that documentation is done, we're gonna say it's a couple days later. Hi, my name's Chanel. I'll be your student nurse again today. The doctor has just ordered for us to take out your indwelling catheter. Can you go ahead and confirm your name and date of birth, please? Okay, that matches up right. I'm gonna raise the bed to a working height again. Okay. Put this down at the bed. Okay, and I'm gonna put on clean gloves now, because at this point I will get the catheter bag and I will empty the urine into a graduated cylinder. I'll measure it at eye level, looking for all the characteristics and making sure to document that. So we're saying it's completely empty now. Okay, Mrs. Smith, I'm gonna expose you here. I'll go ahead and put her in that same butterfly position from earlier. And I got a chuck pad here to catch any, if we have any leakage. So I'm just gonna stick that right under there. And we're also going to say that this is a new clean syringe. I'm going to go ahead and remove the tape here. Drop that in. I still have my biohazard bag here from earlier. I'm going to go ahead and Mrs. Smith, you shouldn't feel any discomfort during this procedure, so, or you shouldn't feel any pain, but maybe a little discomfort. So if it's too much for you, just let me know.
I'll clean up my patient if there's any.
And I'm attaching the syringe, and in the charting it said that we put in 10 milliliters, so I'm making sure that that's what we get out, and I'm letting it refill on its own.
Hook it to this. Now I'm not pulling, I'm just letting it come out on its own. Now I should get 10 milliliters. And I'll do nothing but go ahead and take this off already.
Okay, it's almost at 10 milliliters, so I see it stopped getting any more, so I'm gonna pull it back just a little bit. Now it's at 10. Okay, Mrs. Smith, we're getting ready to take it out now. 1, 2, 3. Okay, we're gonna make sure and keep that facing up to not get any leakage, and I'm gonna unhook the catheter bag down here, and I'll dispose of this in my biohazard bag. Okay, I'll go ahead and discard these clean gloves, and this is when I would put on, do hand hygiene, put on new clean gloves, and I would perform peri-care as needed. We're gonna say I already did that, so I would still have my gloves on at this point, and I'll take away this chuck pad and just dispose of that. Okay, I'm gonna put her back in normal position. And Mrs. Smith, it might be a little uncomfortable for you the first time urinating after having a catheter in, so if you need any assistance, let me know and I'll be happy to help you. I'm lowering her bed to lowest position. I'm gonna make sure her call light is in reach. I'll clean off her bedside table here and make sure she has everything she needs. And then we're gonna say she's all good. So I'm gonna go over and I'm gonna document that I removed the catheter, and we'll document the characteristics of the urine, like color, clarity, amount, odor, any of that. And I'll document how well the patient tolerated the procedure the date and time that it was done.
That is, yes.
Okay, thank you.